Indonesia records its biggest daily increase in coronavirus infections, with more than 54,000 cases. South Africa's government calls up army reservists in response to days of widespread unrest and looting. 23 million children have missed out on their routine vaccinations because of the Covid-19 pandemic. We begin in Afghanistan, where after weeks of rapid territorial gains, there's a glimmer of hope for a halt to the fighting. An Afghan government negotiator says the Taliban is proposing a 3-month ceasefire in exchange for the release of 7,000 of its prisoners. On Wednesday, the armed group took control of the Spitball Duck crossing with Pakistan. Thousands have been left stranded as a result. Taliban fighters in the area are encouraging soldiers to lay down their weapons and surrender without a fight.
When we arrived, I had the government soldiers in my sight a couple of times, but I didn't shoot. We are asking soldiers all around Afghanistan to have mercy on themselves and surrender their guns. The Islamic Emirate of Afghanistan will welcome them and give them amnesty. We have orders not to hurt them. They can see for themselves how we've treated others who surrendered. We gave them flowers and money.
Let's speak now to Kamal Haider. He's in the Pakistani city of Peshawar, near the Afghan border, and joins us now live. Kamal, just explain to us what the wider implications are of this border crossing being under Taliban control for Pakistan.
Well, first of all, you have to understand that the two border crossing, which is the Chaman-Spin-Baldak crossing, which the Taliban have taken over, connects the city of Quetta with Kandahar, is a major logistical lifeline. Thousands of Afghans cross that border in both directions every day. And then you've got the Turkmen border, which is not very far from here in Peshawar. The important thing to understand is that since the Taliban have occupied Spin-Baldak, and according to reports, they have now consolidated their position all along that district of Spin-Baldak. It gives them the key to entry into Afghanistan. Of course, it is also creating a humanitarian crisis because many people who seek medical attention in Afghanistan cross that border to come to Pakistan. Within the next few days will be the Eid holidays. Many family members will be trying to reunite with their loved ones across the border. So indeed a complicated situation, but even more complicated because of the fact that the Afghan National Army may be planning an offensive against these Taliban gains in Spin-Baldak. The Pakistani military therefore on red alert, having deployed to that border just in case the situation worsens. They do not want that fighting to spill over into Pakistan. And also the fact that any configuration inside Afghanistan would lead to another exodus of Afghan refugees. The country already has 3 million of them here and say it cannot afford to have more refugees. So implications for Pakistan all along. But it appears that the Taliban strategy is to go for the choke points, major border crossings, all the way from Badakhshan, which is the border with China, then
shut down. Days of riots and looting have disrupted supply chains, and fears of food and fuel shortages have seen long lines at shopping malls in Durban. The Mines and Energy Ministry says work is underway to help get petroleum products where they need to be. At least 70 people are dead and hundreds arrested after the unrest triggered by the jailing of former President Jacob Zuma. Paramataasa is in Johannesburg with the latest.
There are some isolated cases of looting in the port city of Durban, but here in Johannesburg things are relatively calm. You have people from the community who've come out, and some of them have come out to help the shop owners who lost their belongings during the protest, and they've been cleaning up the streets, helping the shop owners remove what's been damaged and trying to set things up again so things can start running smoothly. You have also on the streets the deployment of security officials as well. The army sitting on various corners here in Johannesburg, outside shopping malls, outside businesses, to make any further looting. Now, this started when former President Jacob Zuma was arrested a few days ago, but it morphed into something bigger than that. It became about inequality and poverty here in South Africa. The unemployment rate is more than 30%. But other people are saying it also that has something to do with factions within the ruling African National Congress. One side within the party believes that another side is trying to tarnish the party's image. They believe that people are trying to make sure President Cyril Ramaphosa looks bad. So all these things are playing out in the meantime, but there's also a regional implication to these strikes. For days now, some of the roads have been blocked in the port of Durban, for example. Some goods can't leave the port city and travel. It's a region, South Africa, where many countries in this region rely on South Africa for food and supply. So normally by road, these trucks come from South Africa, cross into Zimbabwe and other parts of the region as well. So it's also impacting the region. Everyone wanted to know when is this all going to end, but right now, partly because the army is on the ground, we're not seeing any looting anymore, at least for now, here in Johannesburg.
Turning now to the coronavirus pandemic, the more contagious Delta variant is driving cases up globally. Indonesia has now passed India's daily cases to have the worst outbreak in Asia, with more than 56,000 confirmed cases. It's one of the most populous countries in the world, but less than 10% of its population is vaccinated. Malaysia has also reported a record rise for the third day, with more than 13,000 new cases in the past day. The government is turning several hospitals into COVID-19 only facilities. Thailand had been relatively unscathed through much of the pandemic, but recently it's seen a surge. It's reported its worst day so far in terms of deaths, with 98 fatalities, pushing its total death toll past 3,000. Let's get more on the situation in Indonesia now with Jessica Washington, who's in Jakarta. So a record rise there. Just tell us, how is the country coping? How is the health system coping?
Some doctors here say that from their perspective, the healthcare system in Indonesia has already become very, very close to collapse, because they are in the unfortunate position of having to turn away critically ill patients because they don't have room for them. As hospitals edge close to full capacity, it's not just the public hospitals that are struggling, but also some of the public health clinics. And the intention would be that some of those clinics would pick up some of that overflow of patients that the hospitals cannot take in, but they too are struggling. Some of those public health clinic workers have told us that they are understaffed, under-resourced, they don't have enough medication or oxygen for all the sick patients in their local areas. We've heard from local roving medics who try to visit some of the patients in need, and they say that they have sadly become accustomed to finding patients dead in their homes. These patients, many of them, did not even have the prospect of medical intervention. They did not even have the chance to speak with a doctor. So that is the situation here. Now, the numbers that you mentioned earlier, as concerning as they are, some local data agencies say that the government numbers are very much an underestimate, and that by their estimates, the confirmed death toll, which as the government states it is around 70,000, by their estimates, the death toll is actually around 5 times higher.
Just what kind of mitigation measures are in place in the country in terms of social distancing, lockdowns, working from home, that sort of thing?
this latest round of restrictions, which have compulsory working from home for non-essential sectors or restaurants, malls are closed. But some of the criticism that has been levelled against the Indonesian government is that these restrictions have come in a sort of reactionary fashion rather than being proactive, that it took cases to reach this critical point for the government to act, that as oxygen is running out in some hospitals, it was only then that they sought to import oxygen from overseas. So that is really what health workers have criticised the government for not acting fast enough, that if they did, as they say, anticipate that there would be a surge in cases following the Muslim holiday of Eid, that not enough was done to make sure that the health facilities were adequately equipped to deal with that surge in cases. And more concerningly, what we are seeing now, even though Jakarta is struggling under the weight of this recent surge of cases, we're seeing beyond the capital city, which is the most well-equipped to deal with a surge of this nature, in regional areas, in remote provinces, an uptick in transmission. And that really is concerning because some of those areas have little to no healthcare infrastructure.
All right, thank you for that update there, Jessica Washington in Jakarta. Francois has more now on the situation in Malaysia.
Health officials say the number of new cases is expected to increase because the highly infectious Delta variant has been detected in nearly every state. Now, the numbers do paint a rather grim picture. There are now more than 100,000 active cases. That's a record high for Malaysia. The number of new infections continues to outpace recoveries. Health officials are allocating more resources, and that includes allocating more funds so that private hospitals can take in non-COVID-19 patients. This is necessary because more hospitals are now going to be converted to full COVID-19 hospitals. They're going to be more beds as well. And healthcare workers are going to be mobilized from other states to the worst affected areas of Selangor State and Kuala Lumpur. Now, hospitals which have had trouble finding space to store bodies are now going to be getting containers to function as temporary morgues. There are also plans to make self-test kits available on sale. The hope is that new infections can be detected and isolated quickly. Health officials say vaccination is the answer to this problem. But Malaysia is planning to meet its target of fully vaccinating 40% of its population by the end of August and 60% by the end of September. But that's also provided that there are no delays in vaccine supplies.
Still ahead on Al Jazeera. Iran hopes a new locally produced vaccine will boost its slow inoculation campaign. Damaged, vandalized, destroyed. We explore the cultural heritage sites caught up in last year's war between Azerbaijan and Armenia.
It's time for the perfect journey. The weather, sponsored by Qatar Airways.
Hello, we've got an area of very heavy rain just around northeastern parts of China at the moment. A little large area of thunderheads rumbling away here. We're going to see more heavy downpours as we go on through the next couple of days. We've seen some heavy rainfall recently to some parts of Japan, 91 millimetres in the space of 24 hours. That's well over half the July average rainfall. More showers as we go on through Friday. Showers there across the Korean Peninsula. Showers along the spells of rain into that northeastern side of China, on the other side of the LOC. And if anything, those heavy downpours becoming even more widespread as we go on through Saturday. Should be largely dry in Shanghai at around 32 Celsius. Big showers, humid there for Hong Kong at around 31 degrees. Now we see some very heavy rain once again gathering up the western side of India, with the monsoon rains really pepping up once again. So much of western India seeing some big downpours, quite a scattering of showers actually across good parts of India now that the monsoon, southwesterly monsoon, has made its way right across India. But even Pakistan seeing some lively and heavy showers over the next few days. Wet weather once again into the far north of India, gradually making its way to Nepal, to stay very unsettled for much of Bangladesh.
The weather, sponsored by Qatar Airways. Frank Assessments.
Is there an argument for suggesting that the Biden administration has actually been playing a long game?
It's very much of a lukewarm embrace of the Iran nuclear deal because of U.S. domestic politics.
Informed opinions.
Schools and shelters have been reduced to rubble. How do you think this shapes a generation and their politics?
Their entire life has been shaped by this
negotiator says the Taliban is proposing a 3-month ceasefire in exchange for the release of 7,000 prisoners. It follows rapid Taliban gains in recent weeks, including a key border crossing with Pakistan. Officials in South Africa are urging people not to panic buy fuel after the country's largest oil refinery was temporarily shut down. Days of riots and looting have disrupted supply chains. At least 70 people are dead. Indonesia has recorded its highest ever single day of new cases of Covid-19, with some 56,000 cases. Health authorities say the Delta variant is responsible for that surge. Brazil's President Jair Bolsonaro has been taken to hospital for treatment of a blocked intestine. This photo was posted on his Twitter account before he was transferred from the capital, Brasilia, to a hospital in Sao Paulo. He'd suffered days of chronic hiccups. Monica Yanarkev has the latest from Rio de Janeiro.
The doctors have examined him again and have decided for the moment not to submit him to a new surgery. They just said in a statement that he's going to undergo conservative treatment. And so tonight nothing more will happen. We must remember that this isn't the first time that he's had surgeries after he was stabbed in the 2018 presidential campaign. And since then, he has gone through several surgeries in the intestines or abdominal area. So it's going to be now a period of waiting and seeing what new developments there will be. But this is happening at a moment where President Jair Bolsonaro, he's going through the worst period of his 2.5-year presidency. The Senate is investigating the government's handling of the pandemic, which has killed 500,000 Brazilians, and his popularity has been taking a severe blow.
Returning to the pandemic, and Iran is fighting its 5th wave of Covid-19 as the new Delta variant continues to spread. The country is already the worst affected in the Middle East, with 3.5 million people infected and more than 86,000 deaths. Dawson Jabari has more on how Iran's vaccination program is slowly getting underway.
On the stretch of highway in West Tehran sits one of the world's largest shopping malls, and it's now home to the city's biggest COVID-19 vaccination center. This facility is one of hundreds in the capital, and it's open 7 days a week from 8 in the morning until late afternoon, depending on demand. 60 healthcare workers and volunteers run the center. They deal between 500 and 4,500 people every day. In Iran, anyone above the age of 65 is eligible to be vaccinated. 68-year-old Fatane Hersini is getting the Chinese Sinopharm vaccine.
I'm just so happy to be vaccinated. I was so stressed out all the time and worried. I didn't leave the house for a year. Now I feel a bit more comfortable and less stressed.
A sentiment shared by many here. Health officials are currently using the Chinese vaccine and a Russian one across the country. But recently, the domestic vaccine Barakat has been approved. Cobra Esfandiari says she doesn't care which vaccine she gets as long as she is immunized.
I'm glad to get the vaccine. I hope we can get rid of this disease soon. Health is the greatest gift not just for me, but for all society.
Iran has a long way to go to achieve mass immunization. So far, just above 7 billion from a population of 86 million have been vaccinated. Iran has purchased 16 million doses of 4 vaccines through the global COVAX scheme. But the government says US sanctions are to blame for not getting more doses in sooner, and it's now hoping its own vaccine can help.
People can't choose the type of vaccine they get, but hopefully, once the domestic vaccine is mass-produced, we can speed up the vaccination process and get 60% of the population immunized.
Last month, Ayatollah Ali Khamenei was one of the first to receive the Barakat vaccine. Since then, there's been a bigger demand for it.
Tehran's Grand Bazaar, which covers an amazing 10 kilometers of shops and stalls, is supposed to be shut down in accordance with the government's lockdown restrictions. But these shop owners say they can't afford to close. Getting vaccinated is the only real hope for all these businesses and all Iranians to survive an economic downturn as well as the pandemic.
for the National Association of County and City Health Officials. He says a lack of routine vaccination could lead to other types of outbreaks as countries reopen.
Not only is the need to ensure that folks and children get the necessary vaccinations, but we've also seen the rise in vaccine hesitancy and vaccine, poor confidence, for lack of a better word. And as a result, amplified with the lack of access due to both the lockdowns, etc. In the first few months of 2020, even here in the U.S., we saw a sharp decrease in the number of children who were getting their vaccines, their regular routine vaccinations. So it was quite important to ensure that providers understand that they should still be trying their best to ensure both well visits and prioritize, especially for the pediatric cases, the opportunities to get those children vaccinated. It is the hope that we can really get these providers, and as you can see, this problem is now worldwide. It's not just one particular entity, and of course it doesn't necessarily mean that it's only those impoverished or developing nations. It's actually everyone has had this tremendous impact. And the concern, of course, is as we think of we're reopening or reclosing, depending on where you are, the likelihood of other outbreaks to occur. That's why it's so vital to really build this wall of defense, especially upon our most vulnerable population, our children.
France's top criminal court of appeal is expected to decide whether one of the country's largest companies can be investigated for its role in the Syrian war. Cement maker Lafarge continued to operate in areas controlled by ISIL between 2012 and 2014. It's accused of being complicit in crimes against humanity. Natasha Butler has more from Paris.
The factory in northeast Syria, once run by French cement giant Lafarge. Since 2017, French judges have been investigating whether Lafarge paid armed groups, including ISIL, $15 million in protection money to keep the plant running between 2012 and 2014 at the height of Syria's civil war. Although Lafarge evacuated its foreign staff, Syrian employees, including Mustafa, had to keep working.
We asked the company to stop the work, but they didn't stop. The company bears responsibility for all those who were arrested, killed or kidnapped.
This man blames the company for his nephew's death.
My nephew Yasin worked for Lafarge. He went from here to go to his work, and ISIL arrested him and put him in jail. After 4 months, we went to see ISIL and asked about Yasin. They opened his file and told us they executed him.
Lafarge is also accused of selling cement for ISIL and obtaining raw materials from militants. The company, which merged with Swiss firm Holcim in 2015, has admitted some mistakes but denies most of the allegations.
Investigators are examining charges that Lafarge financed terrorism, violated sanctions and endangered people's lives. But in 2019, a French court dismissed an additional charge of complicity in crimes against humanity. Now France's top criminal court of appeal could overturn that decision.
The proceedings against Lafarge are the results of a complaint filed by the French Finance Ministry, 11 former Syrian employees and 2 NGOs.
It's not only states that have responsibilities. Companies who move to countries because it's profitable for them can also end up contributing to international